Okay, guys, here we go. Let's continue on nursing implications, patient teachings. All right, so it says learn everything possible about the patient's health history, determine medication, the use and presence of other diseases, conditions that would influence whether it's safe or not to use the pituitary hormones. Okay, planning says there are no oral forms of pituitary hormones. Okay, they are either given intramuscularly, subcutaneously, intravenously, or intranasally. Okay, and then our patient family teachings tell the patient and family the following. Okay, they should meet regularly with their healthcare provider. No medication should be stopped or the dosage altered without the doctor knowing beforehand. Okay, it also says that patients taking ADHD should measure fluid intake and the amount of specific gravity of their urine. The patient should be aware of symptoms of water intoxication, drowsiness, listlessness, headache, convulsions, and the drug should be stopped, and the nurse and physician or other healthcare providers should be contacted at once if any of these signs and symptoms start to develop. Okay, look at the adrenal cortical hormones. Okay, so our adrenal cortical hormones, the action, it says manufactures glucocorticoids, mineralocorticoids, and small amounts of sex hormones. Remember our three S's, SSS, sugar, salt, sex. Okay, uses for patients with adrenal insufficiency or Addison's disease. Okay, and then it says reduce inflammation and allergic or immunological responses, treat hematological and malignant diseases as well. Okay, it says they are more commonly given to reduce the allergies. The examples of glucocorticoids might be used are acute emergencies, allergic states, collagen diseases, connective tissue disease, diagnostic testing, immaculate states, respiratory disease, and then you have like Bell's palsy, chronic disease as well, ulcerative colitis. Let's highlight this area right here. There we go. All right. So local steroids might be used for intramuscular, for soft tissue, or interbursal problems, and steroids might be used topically for acute and chronic dermatosis, rectal problems. Right there. And ear problems as well. Okay, so some of the adverse reactions. All right, if you look at table 18.8, it'll give you some of them, but we'll go over here. It says that actions of the corticosteroids are normally produced by the adrenal gland or the result of reduced function of the hypothalamic pituitary axis. It says these are not benign drugs. Some adverse reactions are quite common. Others are more usual, and some steroid preparations, particularly ophthalmic drops, may actually be harmful. So read over table, I think it's 18.7 and 18.8. We'll give you some of their adverse effects. So make sure you read over that, okay? So drug interactions. Okay, increased effects of barbiturates, sedatives, narcotics, and certain anticoagulants. They decrease the effects of oral hypoglycemics. See right here, decrease the effects of oral hypoglycemics. And it says Coumadin, anticoagulants, isoniazid, aspirin, broad spectrum antibiotics, and drugs that increase the effects are like indomethacin, aspirin, oral contraceptives, especially estrogen, and those that can decrease are ephedrine, barbiturates, phenytoin, antihistamines, chlorohydrate, rifampin, propranolol. So here's your adverse reactions associated with corticosteroids. Okay, make sure you read over that section, guys. There we go. We'll highlight that. All right, so nursing implications and teachings. All right, so frequent medical monitoring is important, right? Getting the patient's health history, including diseases, any medications that they've been on, making sure that they frequently get checked. You know, a lot of these hormones, they need to have regular checkups to assess for the level of hormone in their body that they're receiving to make sure that it's an adequate amount, okay, and not too much. So frequent monitoring, okay? Patients should avoid smoking, all right? Find out what forms the medications are coming in. Like we said, most of it is going to be given intranasally, IV. None of them are going to be giving, intramuscularly or subcutaneously. It says steroids that are used topically affect only a small part of the body, so be familiar with that. But some of them can actually have a systemic effect as well, so that needs to be monitored and watched with these patients. All right, are they an alcohol user? They're at risk of developing ulcers if they are. Okay, they should know that the onset for some of these medications is 2 to 8 hours, and the effects can last for 24 hours. Patients are at increased risk for infection. Okay, and at times they may need to induce or increase the risk of dosing when the patient's in stress. You know, such as your some of your glucocorticoids. You know, when the patient's at stress and they need an increased dosage to make them work effectively. You know, look for signs and symptoms. Teach the patient to look for signs and symptoms of adrenal insufficiency. They should not stop at taking these medications abruptly. They can have a rebound effect. They need to be tapered off. They should wear medic alert bracelets as well. All right. Immunization considerations need to be taken into consideration with these patients. They may need to eat a diet rich in potassium as well. Show them how to teach them how to appropriately store the drugs. Make them familiar with the different drug interactions. And if they feel like there's some issues going on with the medications, or if a female should happen to become pregnant, they need to call the healthcare provider right away while taking these medications. Now, if the patient misses a dose, it says let's highlight this right here. If the patient misses a dose, let's try again. All right. It says if the patient is on an alternate day schedule, the dose should be taken as soon as possible, and the regular dose should be followed. If the patient does not remember until the evening, the missed dose should be taken the next morning. The day after that should be skipped, and a new schedule will be started. If the patient is on a daily dose schedule, the dose should be taken as soon as possible. If the patient does not remember until the next day, only the normal dose should be taken and the normal schedule should be followed. If the patient is on a divided dose, the dose should be taken as soon as possible and the normal schedule should be followed. If the patient forgets to take the medication until it's time for the next dose, that dose should be doubled, and then the patient should go back to the regular schedule. All right, let's look at sex hormones. Okay, the sex hormones are produced under the influence of the anterior pituitary gland. Anterior pituitary. It says the male hormones, testosterone, and its related hormone are called androgens. And you have the female hormone, estrogen, and progesterone. All right, so androgens do what? They help develop and maintain the male sex organs at puberty and develop secondary sex characteristics. All right, it says anabolic steroids are synthetic drugs with the same use and actions as androgens. says these medications may be given as a replacement therapy for testosterone deficiency, and androgen therapy may also be given to women as part of the treatment for estrogen-dependent inoperative metastatic breast cancer. In addition to the two naturally occurring female hormones, estrogen and progesterone, there are also a number of synthetic preparations. It says estrogen is secreted by the ovarian follicle and the adrenal cortex. It says estrogen helps develop and maintain the female reproductive system and the primary and secondary sex characteristics in women. They are also part of the feedback system to the pituitary. Estrogens also play a role in the fluid and electrolyte balance in tissues. It says they are active in most of the tissue and muscular processes involved in pregnancy and labor. So these are important medications. Progesterone, it says, is also produced in the corpus luteum, is essential for the development of the placenta and helps maintain pregnancy. Also helps prevent pregnancy by inhibiting the pituitary gonadotropins. And it says estrogen and progesterone combinations of the two hormones are very effective as oral contraceptives as well. So let's take a look at androgens. The main action is to develop secondary male characteristics. It's also antenoplastic when used to treat certain breast cancers in women. All right, uses are used in hypogonadism and hypopituitarism, dwarfism, eugenism, and cryptocortism. All right, it's also used to treat symptoms in terminal cases of cancer, palliative therapy for advanced breast cancer in postmenopausal women, and androgens are also used to suppress milk production. And they're commonly misused, of course, by bodybuilders as well. So some of the adverse effects. Okay, hirsutism, excessive body hair, sodium retention, edema, male pattern baldness, cholestatic hepatitis with jaundice. It says in men, androgens may cause a decrease in sperm count, excessive sexual stimulation. Children may also develop short stature because of premature bone epithelial closure. So some drug interactions. You're going to see increased effects with anticoagulants, anti-diabetic agents. Okay, decreased effects with barbiturates, and concurrent use with corticosteroids can actually cause edema. So our implications and teachings: look for patients with cancer issues, cardiac issues, renal, liver dysfunction, other drugs the patient may be taking, and the possibility of pregnancy. Okay. Determine the failure to develop a secondary sex characteristics by age 15, 17. All right, and then our patient teachings are going to include taking the medication as instructed. Let them know that it may take several weeks or months for them to start working. They should be on a high caloric diet, protein, vitamins, minerals, unless otherwise instructed. Okay, the patient should report any new troublesome symptoms: enlargement of breast, shortness of breath, excessive physical or sexual stimulation, prolonged or painful erections. It says the women should report jaundice, fluid retention, especially in the feet and hands. Okay, increased sex drive, masculinization appearance. And it says if medicine is taken under the tongue, they should rinse the mouth and brush the teeth after taking the medication. All right, take a pause right there, guys. I'll send this one to you, and then we'll get another one right back out.